things that surprised me working in the community mental health setting as a psychiatric nurse practitioner compared to the inpatient setting. So right now I currently work part-time for a community mental health clinic, and I work with the SMI population, so the severely mentally ill population. And these are some of the things that I guess I wasn't expecting, or that surprised me, or I've had challenges with in the outpatient setting versus the inpatient setting. And the first one would be the access and the barriers to care. So working in the community mental health setting, a lot of times our patients don't even have transportation that they need to make it to appointments. I was surprised to see just how much of an issue it really is. We even contract with a transportation company, and oftentimes they're late, they don't show up, they're rescheduled, and these patients aren't able to get to the appointments that they need to get to, which some of them are on long-acting psychiatric medications in the injectable form, and it's really important that they stay on top of it and not miss these appointments. The clinic is also in a rural community, and that has its own challenges. So even if they do have transportation, a lot of times they live further away from the clinic, and sometimes they have appointments that need to be on a weekly or monthly basis, and sometimes that can be a barrier to care. The other thing that surprised me is just how much insurance sucks. If you're a healthcare provider and you work with insurances and you've heard the term prior authorization, you know just how frustrating that can be. I, as a psychiatric nurse practitioner, or your prescriber, your doctor, your physician, can say, this is a medication that I think, based off your symptoms, based on your individualized care, I believe will work for you based on my education and the whole thing. I can prescribe that medication based on everything I just said, and the insurance can come back and say, nope, big red tape over what you just ordered, and tell you that you need to try these other medications first, or they're not going to cover it, or all kinds of things. And I guess I had kind you hear about prior authorizations and stuff if you don't work, but coming from an inpatient setting, we usually have the medications right then and there. We have our pharmacy on hand. You can just run, give your medication. A lot of times we have our injectable psychotropic medications as well. And so you order it and it can be given. So in the outpatient setting, I'm just surprised about how many times things come back, and or they're the pharmacy issues, or they're not filled, or there's just so much red tape on the back end that it can be a lot. And coming from an inpatient setting where you have things just right then and there, it was something that's still learning to work with, and it's still frustrating. And I just still don't understand how insurances could play that big of a role in patients' care. Have a list of your community resources. So what I'm talking about is your crisis centers, because as a clinic, we're basically like your primary care for your mental health. So they're pretty much, stable overall. You might need medication adjustments. Typically, they're not in a crisis state. So know your crisis resources. So your emergency psychiatric care, where they do evaluations, where they can find housing for people who are in crisis. Have a list of the transportation you use. Some clinics contract with certain transportation companies, or they may have like an ambulance service that takes them instead of calling 911. You may be contracted. So have a list, and I printed out mine right away, and I gathered all my information together. The local hospitals, detox facilities. So say you have a patient that comes in and they need detox off of some substance, right? We can't really manage that in the outpatient clinic most of the times. A lot of times they need to be medically monitored. So have a list of close resources and everything that's in your community where you could refer these patients out to when you need it, because trying to Google and trying to look up stuff in the midst of a moment or midst of a crisis can be challenging. So I recommend having like a binder. I have a binder of a bunch of resources that I use, and that's on the first page. Who do I contact? You might add like your supervisor or other clinic phone numbers or people in charge that you would need to contact. I have like the medical director's phone number of our entire clinic. So in case I do have questions, then I know who I can go to in, a quick second. Also with community resources, know where the food banks are, know where they're doing toy drives, where they're doing donations, where people can pick that up. Working in the community setting, you're gonna work with patients that live in poverty, that don't have access to food, that don't have access to clean clothing, school supplies. So knowing those resources and knowing where these patients can go pick up food, where they can pick up clothing is very beneficial, because when they're in your office, that's the time that you're really getting to know them. You're getting to know, things that are going on in their life outside of their mental health, or which could be contributing to the stress, the anxiety, the depression, right? If you're going through a financial crisis, if you're going through a health crisis, if your living situation or your transportation isn't where it needs to be, of course you're not going to be in your optimal mental health wellness, right? So know those resources, especially for people who have kids. How are they feeding their kids? Know where they're giving food boxes. I have that all in a resource, and I pay attention to my community and local communities and pick up and drop off stations for where they can get those resources. The other thing in the outpatient setting is just how much of a team effort it really is. So I work in the SMI department, and so we specialize in the severely mentally ill. So when you have that determination, at least in the state of Arizona, you get a case manager, you get other resources, transportation sometimes gets set up for you. There's more resources to help with your chronic illness, right? Your mental health illness. And so you have case managers on the field to one patient. They're going to be, touching base with their case manager, with their therapist, with their prescriber. So it's really a team. So you really need to work together to get all the collaborative information you can to have the best treatment for your patient. So my other tip is be nice. As easy and as simple as that sounds, guys, these case managers work so hard. They bust their butt for these patients. I've seen case managers stay late, get in early just to go pick up a patient, to bring them to the clinic, to make sure that they're here for their appointments, going and getting food boxes for them, all kinds of things. And I just think that case managers really, really don't get the credit that they really deserve. And I just really, if you're a case manager, I know your caseloads are full. I know you're dealing with a lot. And at our clinic, we also do court order treatments. So if you're a case manager working with patients who are on court order treatment, there's a whole other slew of things that are required and deadlines you need to meet. So be nice to your staff, be nice to your front office staff. Your front office staff is going to be the ones who coordinate your schedule, okay? So when people contact and they have issues, if they need medications refilled, they're going to be your go-to as well to gather all that information. Your nurses, your medical assistants, when you need help and you need medication administered, they're the ones giving your injections. They're the ones calling up and filling your scripts. So they're really making your life way more easy, or is that even a word? Making your life way easier. So it's best practice to be nice to, I never get why some prescribers or people are rude to people who are trying to help you. Okay, so we're all a team in outpatient. Inpatient, at least in my experience, it was kind of like you're on your own more. Go in, you round, you see your patients, chart your stuff, change your meds. You talk to the nurses here and there, or they might communicate with you, but I feel like in the outpatient, it's way deeper than that, and there's a lot of information that goes into managing each and every one of the patients in an outpatient setting. Another thing that can be frustrating is getting hospital discharge records. So say there's a patient that goes to our clinic and for some reason they have a mental health crisis, or they're feeling like they're going to hurt themselves, whatever the case, and they feel like they need a higher level of care. So they check themselves in the hospital, or maybe they're petitioned to go into the hospital and they get the care that they need. Well, then they get discharged and they're supposed to follow back up with us, kind of like I said, like your PCP for your mental health. Sometimes these inpatient hospitals do not send discharge paperwork with them. So what happens is I see them normally, something happens, maybe, crisis happens, they go inpatient, they're discharged, and I'm supposed to do their follow-up, but we don't get any paperwork. So it's like, what medications were changed? What did they go in for? What was their, what happened? And having to chase down the discharge paperwork can be time consuming and frustrating for not only me, but for my front office staff. So if you work inpatient on the discharge side, please fax over that discharge paperwork to your outpatient clinics. be nice to your drug reps. A lot of places that I've seen or I've heard, when people who are working for these drug companies, medication rep companies, you'll have a representative come to the office and these prescribers are rude to them and they don't have time. I understand we're all busy, but I've taken the time to actually sit and listen and learn, and they have a lot of information and a lot of tips that are specific to that medication that you might not even get in your resource manual, because that is their job. Their whole job is to work on, market and work on this one medication. I love when the drug reps come. They'll give you their card. So if you have any questions, I've reached out to reps too, where it's kind of like, I know I can give this medication, but what's the soonest I can give it, right? Especially with like your long-acting injectables. And it's nice to have a knowledgeable resource that is an expert on that medication where you can call. On top of that, a lot of times they'll bring you samples of medications. So for example, if I have a patient that's on a long-acting injectable and they've came in and I think, they would do really well on it, their symptoms, they're a good candidate for it. It's nice to get them started then and there, okay? So, but what happens is with our pharmacy, we don't have a pharmacy on clinic. So anything we order, if it's even an injection, has to be delivered to our clinic. So you come into an appointment, I think that we work together, we think that an injection will work good for you. I order it, what happens? You have to come back when it gets delivered, and then days go in between. People forget, they change their mind, their mental health gets worse over that time. So how samples benefit us is that if we have samples already there in clinic, we can just start the medication immediately. I see you have an appointment, we got a sample on hand, yep, go ahead and start it, and then we can order it for your next one to replace that sample. So you only get that when you are cool with your drug reps, okay? So I can't tell you how many times that has saved me, where it's like, okay, they need this medication, or they've had a missed dose and they haven't been in for a while, and for some reason we don't have their actual injection on site. We can use a sample, or the bridge that they can't get to the pharmacy in time, whatever. We have that sample on hand that we could give to them, and then it bridges that gap in care. So these are just a few things I wanted to talk about in the community mental health setting, working as a psychiatric nurse practitioner versus inpatient. And I just barely touched the top of the differences and challenges, and this is just what came on the top of my head right now on my way home from work. That'll probably be a several part series, but if you guys have any questions, leave them down below and I'll be happy to answer them. Have a good day.